Just because you've been diagnosed with knee arthritis does not necessarily mean you're going to need risky knee replacement surgery. In fact, in my clinic at HT Physio, we help people with knee arthritis to avoid knee surgery all the time. In today's video, I'm going to share with you a proven strategy that's both in the literature and the same thing we use at my clinic, which helps people to avoid knee replacement surgery reliably, even if they've been diagnosed with arthritis. My name is Harlow, and I specialize in helping people over 50 to improve their mobility, to reduce pain from arthritis, and to get moving again. And today we're going to be talking about how to do just that when you've got knee arthritis. So I'm making this video for anyone who's been diagnosed with mild to moderate knee arthritis or degenerative changes in their knee and wants an alternative to risky surgery. So in my research process for my latest book, I came across a really interesting research paper published at the Shelbourne Knee Clinic in the US. And basically the authors of the paper, who happen to be knee surgeons and knee physios, they reported on the protocol that they use with the knee arthritis patients that they treat. And as I was reading the protocol, I couldn't help but think, well, this is very similar to the treatment approach that I take in the clinic here at HT Physio. And when I got to their results section, they were having amazing results with their knee arthritis patients. In fact, of the people that came to them who all had at least mild to moderate knee arthritis, 70% of those patients did not go on to require surgery because their symptoms improved so much. So these guys are obviously getting great results, and their program has a very simple philosophy. So they understand that the muscles around your knee, namely the quads that live above the knee, are very important for protecting the joint from pain if you've got arthritis. So if you've got strong quads, that's been correlated with much less pain, even if you've got quite severe arthritis. So strong quads is a really good thing. But if you don't have a full range of motion at your knee, it's very difficult to get your quads to be working at 100%. So what the Shelbourne people did is they focused solely on improving the range of motion of their patients' knees before they did anything else. And when the knee was at a full range of motion, then they started working on the strength. Now, this is really similar to what I do with my patients. And both myself and the guys at the Shelbourne Knee Centre worked out that a movement called extension, which is where you can lock your knee out straight, is particularly important for people who have knee arthritis, because that's the movement that the quads do. And many people with arthritis are locked into what we call a fixed flexion deformity, which means they can't fully extend their knee. And you can test this at home to see if you've got a fixed flexion deformity by lying out on your back and trying to push your knee down into the bed to flatten it out as much as you can. And when you're pushing it fully down into the bed, if you've still got a gap underneath your knee, that means you probably have lost some extension. Just double check that that's different to the other side, and if it is, you've definitely got some work to do there. But that's a really good thing, because it means that if you improve your extension, quite often your symptoms will improve as well. So I'm going to take you through the full protocol today. This is exactly what I do with my patients in the clinic, but I just need to make you aware that this is not going to be suitable for everyone. There are some cases where working on extension aggravates the knee, and if that's you, you should definitely stop this and consult with your doctor. Definitely get checked out anyway before you start this protocol, and if it causes you any discomfort, then just avoid it. Anyway, let's have a look at what the guys at the Shelbourne Centre did and what I do in my clinic, and hopefully it will help you as well. So here are the steps we're going to use to help you stay off the surgeon's table and well away from his knife. Now, there's a 3-step part to this process. So what we're going to do is first, we're going to work on improving your knee extension, which is how straight you can get your knee. The second thing we're going to do is we're going to work on your knee flexion, which is how much you can bend it, so how much you can bring it up like this towards you. And then we're going to work on your strength. And we're going to work on the strength of your quads and your glutes. So this is the exact plan I used just this month with one of my patients who was on the list for a total knee replacement. She was told that she probably needed it. She came to have treatment anyway. And 1 month later, the surgeon called her and said, "Are you ready to come in?" And she said, "You know what? It's improved so much. I want to pause it for a bit and see how we get on with physio." So it's an amazing protocol. And we're going to start off with the extension aspect. So all you need for this is a pillow or a bolster. I'm going to use this special bolster cushion for our first exercise, which is called passive knee extension. And this is you using the muscles in your upper body to help you straighten your knee. Now, it sounds like it might be quite brutal because we're actually just going to be pushing down on the knee, but we do it really gently because remember, we're just trying to gently encourage that extension. We're not trying to force it. And if you go too fast or too hard, you are going to make the knee sore. So set yourself up like this, where you've got your leg hanging with a bit of a gap underneath. That's really, really important. We want there to be clear air between the back of your knee and the bed. And once you're in this position, hopefully you're sat up like this, you can put 2 hands above your knee like this, and we're just going to really gently push down and then relax. Push down and then relax. And when I say gently, I really do mean gently. We're talking probably 10% of your effort here. This is nothing like really jumping on top of it, nothing like that at all. We're just pushing down gently and then letting it come back up. And you should feel almost like a little spring as you go down and then it springs back up. So you can go down and you can release it quite quickly and the knee should just pop back up, and that's absolutely fine. Now, if you're doing this right, you're almost going to feel like nothing's happening, and that is ideal. That's actually what we want, because it shouldn't feel sore. It shouldn't feel like we're hurting anything. But if you do 30 of these in a row, you're going to find when you take your bolster out that your knee is actually straighter, and you can probably push down and get it flatter against the bed. That's a really good sign. If you can do this regularly, I would say at least 3 times per day, it's a great start to getting that extension back. But there's another way we can improve your extension as well, and I'm going to show you what that is right now. So the second way to improve your extension, and this is exactly what the practitioners at the Shelbourne Clinic did, was they did something called weighted heel props, which is where again we put our leg in that position where we've got that gap underneath by just propping the heel up, and then using some of these. So these are little sandbags, they're ankle weights really, and you're going to put one below your knee and you're going to take another one and just place it above. So now we've got a little bit of weight. These aren't very heavy, probably talking a couple of pounds of weight. But just having your leg in this position, you might do this while you're watching TV, is really gently just dragging that knee down into a neutral position. And even though it doesn't feel like much force is acting on the knee, just having it there, I can almost feel already that my leg is trying to come to rest on that bed. It's just slowly increasing that extension. And this can be really good for people who find it painful to do the pushing down, or they've got a really stiff knee and they need all the help they can get. Whenever they're resting, have your leg propped up with these weights on top. And over time, just gaining 2-3 degrees of extension is going to make a huge difference to the function of that knee. So in addition to doing the first one, if you can sit for a couple of minutes a day with your leg like this, that's shown to be super effective at improving the range of motion in that crucial extension. Before we go any further, I just want to tell you about 3-Tip Friday. 3-Tip Friday is my weekly email that I send out to my list, and it features 3 of the most interesting things I've found that week. It could be a health tip, it could be a piece of research I'm reading, or it could be a new tool that I've found to be really useful for helping people get more mobile. It's totally free. I just send it out once a week. There's no annoying promos inside, and you can sign up for it by going down below this video and entering your email in the 3-Tip Friday link. So once the knee has basically got full extension, or as close to full extension as you comfortably can, we're going to work on the second movement, which is flexion. So bending the knee right up. Flexion is vital if you want to ride a bike or if you want to climb stairs. We need it with just about everything we do. So for this exercise, you're going to lie on your back. All you need for this is a towel. So I've got my towel here. And again, we're going to pretend this is the knee that I'm trying to improve. So I have the other one flat, and this one, I'm just going to bend it up as far as I can comfortably. Now, for many people who've got knee arthritis, they can't get it much further than that. And if that's you, that's absolutely fine as a starting point. Take your towel, fold it into a bit of a sausage like this. And what I want you to do is lasso your leg. So you've got the towel somewhere around your shin, and then you're just going to gently use the strength in your upper body to pull your leg up towards you like that, and then back down just a few inches down to take you away from stiffness, and then pull it back up again, and then down, and then gently pull it back up again, and then down, and then gently pull it back up again, and then down, and then gently pull it back up again. And here we're just gently trying to facilitate that flexion movement. And it's super important, and we're not taking this into pain. Just like with all of the exercises on this video, they should be comfortable, they should feel easy to do. We're just going into stiffness, not into pain, certainly not into agony. We don't want you getting off the bed and limping away. You should get off the bed and feel better. That's how you know you've been doing it really, really well. Now, I would do about 30 seconds worth of work on that. So I don't know, 10, 15 in a row, but try and come back to it regularly in the day. The research shows that the more often you come back to it, that's better than doing loads in one go. Okay, so try and come back to it multiple times. I know it's annoying having to go and lie down, but it'd be worth it when your knee is bending much better by the end of this process. A couple of times a day, do that every single day until you've really increased your knee flexion, and that will give you a great chance of now improving your strength, which is what we're going to do next. So the next thing we need to do is improve the strength of your quads, these muscles here. And I've got a lovely exercise to show you. It's called the straight leg raise, and it's brilliant for activating especially the upper quads for people who can't do squats, they can't do lunges. If that's you, don't worry, because this exercise is probably going to be much more friendly for your knees. So again, we start lying on your back. Your affected knee, you're going to straighten out like this. Keep the other one bent. First thing we're going to do is just slowly drop your back down into the bed so you'll feel your tummy muscles switch on, and then pull your toes up towards you. Now, before I show you the movement, if you've got sciatica in the same leg as you've got your knee problem, this probably isn't the exercise for you, but I have other exercises on my channel that will replace it. But if you're all good to go, you're going to keep your tummy switched on, and then just lift that leg up in the air, just so it's parallel with the other leg, and then slowly back down. Now keep your head in contact with the pillow throughout. Do not try and lift your head at the same time, but we're just going to keep that leg moving. And like with many of the exercises I teach, we want to go nice and quick on the way up, and then really slow on the way down. So it's about 4 seconds down, and maybe 1 to 2 seconds up. 4 seconds down, 1 to 2 seconds back up. And after you've done several of these, you're going to feel a bit of an ache going on at the top of the thigh here. This is your rectus femoris muscle that's working really, really hard. And your other quads have to work to keep that knee straight against gravity as well. And it's just a super way to strengthen your quads. You might want to do the other side as well, just to even things up. And I would keep going to the point of fatigue. You probably want to hit, 15, 20 in a row if you can. 3 times in a row, or either 3 throughout the day, whatever you prefer. Just make sure you're getting that volume in, and that's going to go a long way to improving your quads. But we've got one more thing to do, and that final thing is to strengthen the glutes. So I'm going to swap legs. I'm going to pretend now it's this leg that's the problem, so I can face the camera to show you. And we're going to do an exercise called the clam, which is a lovely exercise for strengthening your medial glutes and your gluteus minimus as well. And these muscles are super important when it comes to the alignment of your thigh bone when you're walking. And obviously your thigh bone makes up the top of your knee joint. So if your thigh bone's badly aligned, guess what? The knee joint is also badly aligned as well. So improving the glutes is vital for knee health. So what you're going to do for this is you're going to lie on your side on your bed, and you're going to tip yourself just a little bit further forward than you normally would. Take your top hand and just put it on the bed just for a bit of support. Keep your body forward throughout, and then just lift that top knee, keeping your heels together. You're just going to lift it as high as you can before you reach a natural limit, and then really slowly come down. I'll show you again. So we're going to lift up, squeeze at the top, and then slowly back down, and then up, squeeze at the top, and then slowly back down. Now, if you look at this movement, it's probably a smaller movement than you were expecting from me, but that's just because I've really tipped myself forward. So I've limited what I can do, and I've totally isolated the glute at the back. Now, if you want to see this exercise from a different angle, the bit that's working is just below the belt line. So this muscle here. Now, if I'm going to do it on this side, I tip myself forward, lift just to there. I can't go any higher, and then come back down. You see people doing this and cheating quite often, and the way they cheat is they lift and then they roll back at the same time, and that just takes all of the emphasis away from the glute, so you're just not going to get the same benefit. So keep your body forward, lift up, and just keep going until you start to get some fatigue. And by the time you finish, that's a full workout. That's going to really help your knees, and improving the movement and the strength at the same time is such a winning combo. And hopefully that will give you the best possible chance of staying away from the surgeon. So that was my best attempt at helping you to avoid knee surgery with the strategy we use inside my clinic. I hope that's been useful and helpful. And if you feel it's made a difference to your knee, do drop a comment below and just let us know, because we love to read your thoughts and it does help us to improve this channel too. So thank you very much if you do that. Make sure you're subscribed to the channel, like this video, and consider sharing it with a friend. If you've got someone with knee arthritis and they're struggling right now, do share this video with them, because it will help them and it helps us to reach more people as well. So thank you if you do that. And if you want to get more from me personally, the best way to do that is to pick up a copy of my brand new book, Thriving Beyond 50, the 2024 edition. It's published with Hay House. It's out on the 1st of October. It is the best piece of work I've done to date. It's 450 pages of my best advice, strategies, exercises, all the good stuff that you see on this channel put into a easy to read book. And if you get a copy, I hope you enjoy it. You can find it by following the link below this video. It will take you to Amazon where you can place your order. So thank you if you pick up a copy. I hope you love it, and I'll speak to you again on the next video.